Morning. eScribe is still down, but we can proceed without it. There's only one item, so we can proceed with. Okay, we're having different. Okay, okay, thanks. Just an update on eScribe. We have republished, so you should be able to access now.
Great, I'm in. Thank you.
Good morning, colleagues. I would like to call this meeting to order. We'll do the roll call. Councillor Jans.
Here virtually.
Thank you. Councillor Rice.
Good morning.
Councillor Cartmel.
Good morning.
Councillor Salvador.
Good morning.
Councillor Rutherford.
Here.
Councillor Hamilton. She'll probably be coming. I'm here. Councillor Tang.
Good morning, everyone.
Councillor Paquette.
Good morning.
Councillor Stevenson.
Hello.
Councillor Principe.
Good morning.
Councillor Knack.
Good morning.
And Councillor Wright. Okay. Adoption of the agenda. Who would like to move that? Councillor Tang?
I can move the agenda for November 9th, Emergency Advisory Committee.
Please second.
Second.
Councillor Tang, Councillor Rice, thank you. And then please vote. The voting is not popping up. I affirm the vote.
Okay, thank
As
you.
everybody has voted?
Yeah, everyone has voted. We have
Please
it.
display the vote. Can see it.
It's carried.
Is carried? Okay,
Yep.
good.
Thank you.
Adoption of the minutes, none. Protocol items, none. Request to speak, none. And request for time specific, none. And we have only one item, COVID-19 update, verbal report. That needs to be selected, right?
Yes, I'll select
Correct.
item 3.1.
Thank you, Councillor Stevenson. It must be selected, good. Okay. We are here.
Great.
Are you going
Thank
to
you
give
very
us a
much.
presentation?
Yes, Your Worship and
City
Councilors,
Manager?
thank you very much.
Thank you so much.
So this is your first meeting of the Emergency Advisory Committee, and I'm here to provide you with a presentation and answer any questions you have about the city's response to COVID-19. This is being presented to you for information, and no direction is needed in this meeting today. However, depending on what this committee discusses and recommends, we could go to council for a decision as early as this afternoon or this week or the 22nd. So we will foreshadow that conversation and provide some options for your consideration that would need to be approved by council. Joining us today are our guest, Dr. Christopher Sikora, the Edmonton Zone Medical Officer of Health with Alberta Health Services, and you'll hear from him in a few moments. Also joining are city staff members of the executive leadership team, and Nicole Poirier and Nancy Jacobson, who co-lead the city's COVID-19 task team. Today we're going to review the past 19 months of the city's fight against COVID-19, where we have been essentially. I will highlight some of the city's work and will ask Dr. Sikora to provide some current health information of where we are. Then I will outline some future decisions council may wish to consider in terms of where we might go from here. In February of 2020, the then city manager established a COVID-19 task team. It was a temporary group of city leaders to help the city of Edmonton support its employees and help Edmontonians respond to the COVID-19 pandemic. Its function was to coordinate successful operational actions and behaviors and make sure employees and Edmontonians were safe. They did establish a level of competence that gave employees and Edmontonians a sense of comfort that things were being well managed, and we managed the demands of COVID while not losing sight of our corporate direction, and we nimbly responded to an unexpected financial pressures that were related to COVID. The task team had members from across the organization, including city operations, citizen services, as well as communications and engagement, integrated infrastructure services, urban planning and economy, employee services, and financial corporate services, along with many external partners from the Edmonton Public Library and the Edmonton Police Service. We made decisions at the time with the information we had. When we better understood the risks of transmission, we reopened our services as appropriate. And what we have learned is throughout the pandemic is just how nimble we have to be to protect the people who live and work here in our city. And our mantra has been to learn what we can, make decisions with what we know, and move as quickly and deliberately as possible. Before we get too far, I wanted to highlight a couple of things that are important to know. The province of Alberta is, of course, the health authority in this province, and they are in charge of the health of all Albertans, including all Edmontonians. And we don't have a health department here at the City of Edmonton. We rely on provincial expertise and support that comes mainly from two organizations, Alberta Health, the department, and Alberta Health Services. There is a difference between Alberta Health and Alberta Health Services, of course. Alberta Health is the policymaker and funder, while Alberta Health Services is the implementer of policies and operational service delivery to Albertans. It's obviously a great deal more complex than that, but it's something to keep in mind, and noting, of course, that Dr. Sikora here today is from Alberta Health Services. Dr. Dina Hinshaw, whose name has become familiar in in Alberta households, is the Chief Medical Officer for Health across the province, and she is a member of the Alberta Health Executive Team and reports to the Deputy Minister of Health. Dr. Sikora is the Medical Officer for Health for the Edmonton Zone, and he works for Alberta Health Services. Dr. Sikora will speak to us shortly. He has come to committee many times over these past months as a courtesy and has helped guide us through some of the decisions that have had to have been made, and more importantly, has shared information about how Alberta Health Services has been combating the virus. And I think it's important to clarify at this point that he's not a representative of the department nor the political wing of the government. And I can tell you he has been a great asset personally to me, as well as other doctors in the Edmonton area, including doctors from the University of Alberta and the association here in Edmonton. They've all been tremendously helpful to us in terms of providing advice to this council. Now, this slide provides a snapshot of where we've been with COVID-19 cases over the past couple of months. I think that it is also a good time to talk about the difference between some of the numbers you've seen. Dr. Sikora is the Chief Medical Officer of Health for the entire Edmonton Zone, which includes many of our regional partners such as St. Albert, Morinville, Parkland County, and Leduc. Sometimes you'll see numbers that are Edmonton specific, and sometimes they're specific to the greater Edmonton zone. For instance, the number of cases per 100,000, the active case rate on the chart above in Edmonton proper is lower than the rate in the entire Edmonton zone. For example, the zone rate is 107.1, while the city's rate is 84. As you can see on this slide, cases have gone down significantly over the past month, including Edmonton's R value, which measures the virus spread. An R value of under 1 means that every time someone gets COVID, the spread is to fewer than one other person. If the R value is over 1, that means it's spreading to at least one person, but possibly more. The R value noted here is for the last week of October. And the R values have been declining, which means that community spread is declining. And we are hopeful that this continues through the holiday season coming up. On this slide, you can see the number of vaccinations across the province and here in Edmonton. As well, the number of vaccinated Edmontonians over the age of 12 continues to rise. We're hoping to continue to see that rate increase as the work we do and the work that the province of Alberta does convinces more Albertans to get the shot. Now, when we first asked employees to disclose their vaccination status in September, 76% reported that they were at least partially vaccinated. Since then, the city has introduced a COVID-19 vaccination policy, and I'm pleased to report that as of November 1st, 94% of our employees are now fully or partially vaccinated. This policy has made a real difference for the health and safety of our employees, the Edmontonians who visit our facilities, and ultimately the entire healthcare system. The vaccination policy is in addition to other workplace control measures such as the pre-shift screening, physical distancing, masking, capacity limits, and of course staying home when you're sick. They are all in place to do our part in reducing the spread of COVID-19 and mitigating the impacts of services during this critical time in our efforts to end this pandemic. Employees who have not provided proof of full vaccination are complying with the rapid testing program, which began at the beginning of this month. Since then, about 660 employees have been using rapid tests. Only 41 employees out of the entire 13,000 have not complied with the policy, and they have been placed on leave without pay. We do have 15 approved medical exemptions from the policy. Now, early in the pandemic, the city made a decision to communicate early and often with employees. Our philosophy was that we had to have over 12,000 ambassadors to communicate what the city was doing to keep employees and Edmontonians safe. There were emails, postings to our internal website, and live stream chats with leaders speaking to the COVID-19 situation. We developed the employee guide for COVID-19 to support employees, and we update it regularly to be a reliable source of truth. We're currently at version 53. It contains valuable resources and information like how to work remotely, information for the employees who unfortunately had to be put on temporary layoff at the time, and supports for reducing the transmission of COVID-19, including policies for isolation and quarantine, masking, and our pre-shift screening. We are acutely aware of the mental stress that this pandemic is having on city employees and, of course, all Edmontonians. And during the past year and a half, a new version of our already established employee and family assistance program called LifeWorks was rolled out, which offered more services online and by phone. Additionally, 25% of our employees are trained in Working Mind to support mental health. As well, in an effort to fulfill our cultural commitment to safety, we surveyed our employees. Approximately 80% of our employees who participated in the survey felt confident in the city's precautions to minimize the risk of COVID-19. Currently, the maximum capacity allowed in City of Edmonton workspaces is 33%. Although most of our employees have continued to work at our facilities safely throughout the pandemic, many employees have been working remotely where possible, and this is in line with the provincial health restrictions currently in place. Last year, we implemented a hybrid work arrangement with city employees, which is currently on pause because of the existing health direction. Employees will work a combination of time at the office and time at home, and this is currently scheduled for early next year if the province's work-from-home public health order has been lifted by that time. Of course, we will continue to reassess our plan to return some employees to their workspace based on the COVID-19 risk, and when they do return, many of the other layers in our safety protections will remain in place. And I always like to emphasize that 70% of our employees have been working at work throughout the pandemic this entire time. Edmonton Transit Service remains a reliable source of transportation, connecting people to each other, their community, and the places they need to go. We have been running full service levels since September of 2020. COVID-19 has affected transit agencies right across Canada and the United States, and ridership has declined while cleaning activities have increased. In the case of Edmonton Transit Service, as a result of our operator vaccination rates, we are temporarily adjusting bus service frequency by 3% until our workforce levels are back to normal. And this doesn't impact LRT or the on-demand or DAT service. During the pandemic, transit users who need transit to go out to do their daily lives have continued to use it. It has been critical to us and to those we serve to keep transit running during this pandemic. It is an essential service, and we've kept it going using enhanced cleaning processes, requiring the use of face covering and measures like dividers between operators and riders. Our recreation centers have gone through a lot of change since the start of the pandemic. They were closed quickly at the beginning of the pandemic, which came with a number of logistical issues. Like, is it better to keep water in the pools or to drain them if we don't know when they're going to be open again? These facility closures, unfortunately, also came with temporary layoffs for some employees. Then things across the province started opening up again. We worked to slowly open rec centers as well, but then there were further logistical issues to work through. For instance, our lifeguards need to maintain training certification to keep people safe, so how do we quickly put training together to recertify them? Our rec centers started opening one by one while adjusting and changing processes and procedures based on restrictions of the day. And this included the use of a time entry reservation system and capacity limits. And today our recreation centers are participating in the province's restriction exemption program, requiring proof of vaccination or a negative test for anyone 12-year-old and up. And I have to say that Edmontonians have been very helpful in all the use of our facilities. The compliance rate of Edmontonians has always remained consistently high in the high 90% rate, and that includes people who ride the buses, people who come to our facilities, and we really appreciate that cooperation and support from Edmontonians. And I would also like to shout out to those organizations who have used the rec facilities, the hockey organizations and the parents and families that run a lot of those organizations, because they have been largely responsible for maintaining protocols as they use Edmonton facilities, and they've been very professional and supportive of the protocols as we've gone forward. The Edmonton Valley Zoo and newly renovated Mootart Conservatory were both shut down at various times during the pandemic and are now back up and running. In fact, 2 weekends ago, we saw huge attendance at Boo at the Zoo in a way that was safe for Edmontonians and the folks who work there and the animals, of course. Of particular note for recognition are the amazing staff at both the Mootart and the zoo who went above and beyond to ensure plants and animals were well taken care of during the past 19 months. Now, throughout the pandemic, much of our work has involved trying to keep those who are the most vulnerable safe. Now, as you've heard in other briefings, the Government of Alberta is responsible for ensuring sufficient emergency shelter spaces exist for people experiencing homelessness. At the beginning of the pandemic, the province developed shelter guidelines designed to protect the people who use emergency shelters as well as their staff from COVID-19. These guidelines included new physical distancing requirements for sleeping and using the shelters, as well as a process for COVID-19 screening and a requirement to isolate symptomatic people. These requirements immediately removed nearly 300 beds from Edmonton's emergency shelter system. In addition, some other facilities were transitioning their services away or in the middle of rebuilds. This added an additional burden to an already depleted system. The City of Edmonton has always taken its role in protecting those who need it the most, and we have traditionally played a role in problem-solving, planning, and filling the gap in space between the provincial government and social agencies providing their services. An example from early on in the pandemic is when the city activated the Edmonton Expo Centre with support from a number of social agencies, including Homeward Trust and Alberta Health Services. This activation filled an immediate day program and a COVID isolation center gap for individuals who did not have a home when the stay-home recommendation was made by Alberta Health. Over the past year or so, we have also licensed a variety of city-owned facilities for day services and shelter, including the Expo Centre, Kinsman Sports Centre, Central Lions Centre, Senior Centre, the Commonwealth Stadium, and the Spectrum Building. Last winter, the city, with the assistance of the Mustard Seed, Bissell Centre, Boyle Street Community Service, and Bent Arrow Society, established a temporary shelter at the Edmonton Convention Centre to meet demand in the depleted emergency shelter system. This shelter was funded primarily through dedicated COVID-19 funding from other levels of government and with additional financial support from Homeward Trust and the Family and Community Support Services. The global pandemic has brought to the forefront a problem we've been working on for some time. Housing and homelessness, protecting our most vulnerable, is and continues to be a priority here in the city, especially during COVID-19. The solution to homelessness is housing. We're committed to increasing the supply of affordable housing through a variety of housing choices in all areas of the city, but the number of people experiencing homelessness has nearly doubled during the pandemic. And we've talked about this in other meetings, and this is something that is an urgent action for the city. To that end, Housing and Homelessness team will be coming to committee and council shortly. They're going to provide more fulsome update of city activities supporting homelessness, including an update on winter emergency shelter and extreme weather planning. Right now, the winter pandemic report is scheduled to go to committee on November 16th. In addition to COVID-19 supports for vulnerable Edmontonians, we've worked to support all Edmontonians throughout the crisis. We continue to be a partner with groups within Edmonton to help them protect those in their communities from COVID-19. These community tables are resourced by the Province of Alberta and facilitated by the City of Edmonton. The city's main function is to facilitate the conversation between community table members and to help ensure funding from the Government of Alberta was fairly distributed and allocated where the community felt the funds would have the greatest impact. Vaccine hesitancy is one issue we saw in some communities in Edmonton. We want to make it as easy as possible for all Edmontonians to get access to a vaccine. This is why we worked with our community table partners to get vaccination and COVID-19 information to those who needed it most, and using pop-up vaccination clinics in community sites and city facilities. We helped facilitate more than $1 million to our community partners in Edmonton to help with this goal alone. This led to a number of initiatives, including a phone number that people in these communities can call to help with COVID-19 information and to provide support where needed. We also supported our local businesses during this time. We developed a page on our website with specific supports from all levels of government that our businesses could apply for. This included individual business grants as part of Edmonton's Economic Recovery Program, specifically developed to help local businesses with costs associated with COVID-19. These grants could be used by businesses who purchase the custom masks and other personal protective equipment to help stay safe. Or they could be used to install hand washing stations or put plexiglass partitions between them and a customer. COVID recovery funding was also provided to festivals and event producers to encourage their return by offsetting additional costs as a result of the virus. At this point in time, I'd like to ask Dr. Sikora to speak about the current status of COVID-19 in Edmonton zone. And after that, I'll talk a little about where we are as a city currently, as well as the future of what we're going to do here in Edmonton to combat COVID-19. So, Dr. Sikora, over to you, please.
Great. Thank you very much, Mr. Corbold, and thank you very much for the opportunity to be here today to support discussions. I think as we get into the whole aspect of getting ready for recovery, it's important to note what our key priorities have been over the past several months. Is my audio okay? Okay. Sometimes I speak a little bit softly. I apologize. Really, we have had three major priorities. One has been to reduce transmission or opportunities for transmission of COVID-19. Second, protect our population through the effects of vaccination or immunization. And we saw that graduated and stepwise approach of healthcare workers, elderly, medically comorbid, those over 12, eventually third doses for those that have multiple medical conditions, and then the upcoming immunization campaign for the 5 to 11 once vaccines are improved. And then the third being preserve our hospital and healthcare infrastructure. So where we're at right now is the latter half of fourth wave. We've seen this large spike over the September, October, and now into November time period, but we're on the latter half of that. We see that R value being less than 1. We see our total case numbers decreasing on a daily or at least on a regular basis. Our active cases within the Edmonton area are less than 100 per 100,000. That being said, it's important to note what we have in terms of our hospital infrastructure. Mr. Corbold did indicate that we have, at least in the Alberta environment, still our exemplary ICU spaces being utilized when individuals are admitted into critical care spaces. They do spend several weeks in there. We are over our baseline across the province. We have at baseline about 173 ICU spaces. We're at 307 right now. So we still are in a healthcare infrastructure, still in the midst of a COVID response. So when we talk about getting ready for recovery, what that means is, what are the things that all of us can and should be doing over the foreseeable future to get ready for a post-COVID, or at least after this wave? So we do continue to take direction from Alberta Health around what some of the broader public health policies are on this, but we still continue to want to have those reduced opportunities for transmission. That means the safe for work, safe for play, safe for learning type screening, daily symptom checks, the hand hygiene, the usual messages of don't touch your eyes, your mouth, and your nose, use of a face mask to protect yourself as well as protect others around you. Get tested if you have symptoms, and then supported by our CMOH orders, if you are positive, you have an obligation to isolate. And the other being, when it's your turn to be immunized, please take that availability to do so. We've made it as easy as possible. It's safe, it's very effective, it reduces your chances, and it reduces your chances of having a severe infection by a lot. And it's the best thing you can do to protect yourself and protect the families and those around you. We are awaiting Health Canada direction around the 5 to 11 population, but within our AHS construct, we are taking steps to help prepare for that. One of the other things that we've noted during the pandemic is the perhaps abundance of misinformation. Alberta Health is a very trusted source of information for all things COVID related. Best information for what those risks and benefits are of immunization, what those resources are for individuals, for families, for workplaces, those support documents and guidance documents for businesses around restrictions, as well as, well, just anything COVID related generally. So with that, I think we'll turn this back over to Mr. Corbold around our current restrictions.
Thank you, Dr. Sikora, and we will, Dr. Sikora will be available for questions in just a few moments as I finish the presentation. The current provincial health restrictions as laid out by public health order from Dr. Hinshaw include the following: indoor masking requirements, indoor social gathering restrictions, physical distancing from any other person who is not a member of the person's family or cohort, limiting capacity in some businesses or entities to 33% of the total operational occupancy load, like here in City Hall, and limiting capacity at indoor weddings and funerals. In certain facilities outlined in Dr. Hinshaw's order, these restrictions do not need to be adhered to if they are part of the Restrictions Exemption Program, commonly known as REP, requiring people to show proof of vaccination or negative test and identification. Our recreation centers are an excellent example of facilities that qualify for the REP program and who are using that program. Restaurants are another example. Early on, retail facilities were excluded from places that qualify our exemption program, and that's not the case now. The city's temporary mandatory face coverings bylaw has been in place for months. It states that anyone visiting a public space in the city must wear a face mask or a face covering. Currently, the bylaw is in place until December 31st, 2021 of this year, or when we have 10 consecutive days of which COVID-19 case rate of less than 100 per 100,000 people, whichever comes first. And as of today, we are at 5 consecutive days of under 100. The bylaw was put in place before the province of Alberta enacted its rules requiring Albertans to do the same. From nearly the very beginning of this pandemic, face masks have been one layer of protection from COVID-19 that we know works. Of course, the bylaw was enacted by Council, and Council can choose to modify it as you see fit, but not at this committee meeting. It has to happen at a Council meeting. As you can see, as of November 7th, we are at 5 consecutive days of information reported with fewer than 100 active cases for 100,000 people. As stated earlier, our temporary mandatory face covering bylaw is currently tied to these numbers. The bylaw is set to become inactive in the near future, which is good news in terms of the case counts, and it's wonderful to see active case rates continue to go down. Now, even with this bylaw inactive, the Chief Medical Officer of Health order says that people must wear a face covering in public spaces. Edmontonians will still have to follow those rules if we get to that trigger point. Earlier this fall, we asked the previous council to add these triggers to the bylaw in a time of governance transition. The municipal election was weeks away at that point, and it was important to provide some certainty to the bylaw during this period. Now that a new council is in place, you may choose to change the bylaw, its timing, or the triggers that I've talked about. Well, a council meeting is the only place where the bylaws can be changed. I do want to get the options here at this committee for your discussion and consideration. There are 3 options for the approach with a face covering bylaw. First, use a community-based trigger. In other words, when cases drop below a certain level for a certain period of time, remove the requirement to wear masks in indoor places. Right now, the trigger of the bylaw is 10 consecutive days of below 100 cases per 100,000. By way of another example, the city of Calgary recently adopted a 28 days below 100 cases per 100,000. Second, use a specific date to bring about the expiration of the bylaw. The previous council had chosen December 31st, but that was a long time ago. And in part so that council would not have to frequently revisit the discussion about keeping the bylaw in place or not. The third approach is to remove the triggers and bylaw expiry date altogether and leave the bylaw in place until council directs otherwise or administration recommends to council that we do otherwise. This approach would be consistent with a lot of other cities' bylaws and a lot of other cities that weren't going through municipal transitions as we have recently. To be clear, these are options to discuss at a council meeting, but you can certainly discuss them here. I can only present you with the information for your consideration in terms of decision-making at a council meeting, but we could do that as early as this afternoon if you so choose. For today, we just wanted to put this on as a reminder, and we know it's something that you may want to discuss today. We continue to learn new information about COVID-19 every day, and we're constantly monitoring the epidemiology with our partners at Alberta Health Services. with Alberta Health as well as other municipalities across Canada. We work and consult with regional health experts, advocates, and the University of Alberta doctors. Business areas continue to operate in keeping with the provincial orders restriction and guidance, and in some instances go above minimum requirements to ensure residents are confident in the services. When and if required, the COVID-19 task team is convened to provide advice and guidance to our executive leadership team and ensure an integrated response to changes in provincial orders, restrictions, and guidance documents. We are trying to be nimble. We will continue to change our response to this pandemic as we learn more, and we will continue to treat the protection of Edmontonians from this virus very seriously. What we do know is the same thing that Dr. Hinshaw has been saying for over a year. It is vital that Edmontonians who can get vaccine get one. And if you feel sick, particularly with flu season coming along, you must stay at home. But eventually this virus will become part of our day-to-day lives, and we will have to learn to live with it. And we invite you in City Council to help guide us along that path. And with that, I'm happy to take any questions you may have. And as a reminder, we've got Dr. Sikora still here with us, so if you have any medical questions about Alberta Health Services perspective, of course, we're happy to also weigh in with our subject matter experts. So thank you for your time today, and we look forward to the discussion.
No, thank you so much for the presentation, and also Dr. Sikora, thank you so much for being with us and your ongoing advice and guidance on this very important issue that is in front of us today, but something that we have been dealing for last 19 months as a community. So before I go into questions, just quickly want to clarify all the other measures that the city has in place will continue. The only pending issue that will come to expiry is the face covering bylaw in 5 days.
Yes, that's correct, Your Worship. And just as a point of clarity, there are two key decisions that Council makes. The Emergency Advisory Committee can in fact declare a state of local emergency, and we're not recommending that at this point in time. That's something that this committee can do. The other key decision is bylaws, which Council makes, and the key bylaw that has been up for Council consideration has been the face covering bylaw.
Okay. And you're suggesting 3 options. One is keep the triggers, but to the extent the number of days, 228 or whatever other number, or have a specific date for the expiry of the bylaw?
What we're recommending, well, these are the 3 options available to Council, so we can keep triggers and we can amend the number of days.
Yeah.
We could set another date for expiry date, because no matter what we do, no matter what the triggers say, right now the bylaw would expire on December 31st in its current form. What we're going to recommend if we go to Council on this is the 3rd, which is let's just remove the triggers altogether. We can call an Emergency Advisory Committee meeting anytime we want, and we can watch the numbers closely. And if we get into a position where we think that we would like to recommend to Council to change the bylaw, or if Council wants us to bring a recommendation, we can do that at relatively short notice. And so I think that the days of triggers made sense when we were going through an election transition and when the bylaw expiry date was well into the future. But I think as we're getting closer now, my advice would be the 3rd option, which is to just remove the triggers. And we'll come to Council in lots of time to make a decision.
When you're out of the woods, you will make the determination to expire the bylaw.
That's correct.
Got it. Okay. Thank you so much for that. Councillor Paquette.
Thank you, Mr. Mayor. I believe I was actually 3rd. I'll just check in with the other councillors to see if they would prefer to go for me. No? Okay. Well, thank you very much for the update, and really do appreciate it. Dr. Sikora, I've got a quick question about this new types of Western Canadian COVID that are popping up, and I frankly don't know enough about them and their virality, and I'm just wondering if you have any information on that.
So what we do know about COVID is that it does mutate. So as a virus, it may mutate into a different variant, and it may mutate into a variant of concern. And a variant of concern really being something that has increased transmissibility or increased virulence. It takes quite a bit to be able to define whether something is a variant of concern or not. Now, as the virus changes, we have that ability within our laboratory infrastructure across Canada, North America, and certainly around the world to be able to monitor what those changes are and whether they are transmitted from person to person, but also are they of increased pathogenicity or increased risk of potential to individuals. So jury is still out. There's still a lot of investigation that has to be undertaken with any of the new variants that pop up. And as that does evolve, I know we will be communicating that both nationally, but also locally.
Right. Okay. So if we give a chance for the virus to replicate, we are in effect giving it a chance to mutate. So I got that. Okay. So we know that this variant came up from the Midwest and then changed when it hit Western Canada. So I'm also looking at the reopening of borders quite soon here. And there's going to be a lot of mixing of folks who are carrying a lot of possibly different strains. So, I know in the summer we kind of thought, well, we didn't, but some people thought that we were in the clear. But we can see a fifth wave sort of rising in other parts of the world already, despite vaccines, simply because of, I guess, lax protocols and this mutation actually occurring. So I'm just wondering, in your opinion, is it reasonable to remove these restrictions so that instead of having particular cases under 100,000, because frankly, new mutations can spread differently than old mutations. Is that reasonable to remove the triggers and instead maybe go with keeping our finger on the pulse?
So it's a great question. Borders themselves are under our federal jurisdiction, so not under Alberta Health Services or Alberta Health. I know from what is being done with the gentle and stepwise border reopening, there is some traffic that is allowed, but it's not unmonitored traffic. So there is still a continued need to be able to have that hand hygiene, the masking, more importantly, the testing, as well as the immunization processes undertaken for individuals that transit back and forth between either Canada, the United States, or Canada and other international destinations. Now, that's
I'm just going to pause you there for a second. I've had many reports, it's all anecdata, but of a lot of these tests being actually extremely lax. But that's not my question. My question is actually, is it reasonable for us to get rid of the triggers and instead just keep our finger on the pulse here and watch to see how the global and local impacts are before we lift any mandates?
So we do have continued monitoring within the Alberta and Edmonton context around testing. We have increased immunization that's been steadily increasing over the past several months. We still have the continued mandates from our provincial counterparts around hand hygiene as well as masking, but also that mandatory isolation should an individual be positive. I think it's understandable that the decision makers in any of the levels of government weigh the risks and the benefits of those interventions against the need, or at least the wants to have increased freedoms or at least increased mobility, but those are some of the risks and benefits that do have to be balanced.
Okay, so my question is reasonable to lift our current 100 folks over 100,000 if there's under 100 infections per 100,000 people for 10 days? Is it reasonable to get rid of that as our metric, move to something that is a little bit less specific so that we can actually monitor a bit more organically? Is that reasonable then for us to consider that as regarding our masking bylaw?
I think having a flexible metric, and I believe as Mr. Corbould described, the 100 per 100,000 was a metric that was utilized for a period of transition between councils, and that perhaps an option to move to a more flexible option to remove and really have those have that opportunity for broader discussion is a reasonable approach to have. Mr. Corbould?
Thank you, Councillor Burkett.
Thank you.
I
Quickly?
would just agree that it's reasonable.
Okay, thank you. Councillor Knack?
Thank you, Mr. Mayor, and thank you both for the presentation and for all the work that you've been doing over the year and a half or more now at this stage. So what I heard, and I just want to make sure I wrote it down correctly, Dr. Sikora, you said there are still 307 ICU spaces being used across the province, so we are technically over capacity. We have surge space for them, but we're not within our regular capacity. Is that right?
That is correct.
Okay, thank you. I guess just more broadly, I'm wondering, particularly to you, Dr. Sikora, if you have any, what our lessons learned were from the fourth wave, and what we should then be thinking about in terms of this next step on the option. I've heard a couple of options. I have a couple other things I want to ask about, but maybe 1 or 2 minutes on lessons learned, which I know is probably a short amount of time for all the lessons learned.
Oh my goodness. Those are just small questions. I think when I reflect back on, of course, waves 2, 3, and 4, each of those waves has been different. One of the primary differences being the power of immunization itself. We saw that large blunting of admissions to both hospital and critical care spaces in the highly immunized population. So immunizations work. And we saw that big power, or that big effect over the fourth wave. With many more individuals who were unimmunized or under-immunized in the critical care and hospital environments. So immunizations work, and that's perhaps one key learning. It also highlights the power of what our social interventions have been over waves 2 and 3. So masking works, physical distancing works. The safe for work, safe for play, safe for learning works. These are all things that are very effective in helping reduce those opportunities of transmission. And Albertans and Edmontonians have been exceptionally supportive of being able to do that because, well, if you have a 5% chance of being admitted into hospital if you have COVID, well, reducing your chances of that is something that's important. So we took that in stride, that we want to remain healthy. We want our communities to remain healthy. We want our workplaces and our places of learning and our places of business to remain healthy. So we've done incredible things to help reduce transmission. Now, as we go forward, we're contending with long COVID. So the health outcomes as a result of a great number of individuals in Alberta that have been affected by COVID-19. We're contending with the social disruption that has been the past year and a half, mental health stressors, economic stressors, education stressors. We're supporting primary care in helping take care of the long COVID. We're in the healthcare infrastructure trying to respond and recover from the surgical procedures that have been delayed over the past year and a half. And as we move into that more recovery phase, this is going to be an all-of-society approach. And partners in community, in municipalities, and in healthcare and beyond are all going to have a part to play in this. Now, will we have a fifth wave? And I don't know. But our learnings from the fourth wave are such that those protective measures to reduce transmission, protect yourself, and then monitor your own symptoms are all things that will have to remain for us to remain healthy as a city.
Appreciate that. Thank you. Yeah, and so for me, and to Mr. Corbould, to your question, I think we absolutely need to have something, because if by chance the province tomorrow did remove health orders, which I don't get the sense they're going to do, I'd like to have something at this afternoon session so that we can, or tomorrow's session, to just something before the 10 days is up in case something happens. So my last question is just informing that. You've suggested maybe not having any triggers, which on one hand makes a lot of sense to me based off everything I just heard. The one thing that does sit a little bit in the back of my mind is there anything that provides that sense of hope to people, or that message of here's our common goal we want to work on and achieve? And so is there value, and looking to you, Mr. Corbould, maybe Dr. Sikora, about, along with maybe going to Calgary's number of 100 or 28 days, but also saying like 80% of children ages 5 to 11 have to be fully vaccinated, have a couple of metrics to give something to hang on to?
Yeah, I mean, I would start by saying we did a lot of this consideration when we arrived at the cases per 100,000, as you may recall, and we looked at our values and all the most helpful data on deciding mask policies is the cases per 100,000. And at the time, we were well over 100 up into the 200s, and it was a very clear line. So my advice would be the other metrics, while important and give a different perspective, become very confusing for everyone involved because you get different perspectives. And the one that is, and Dr. Sikora may be able to speak to it, will be able to speak to it better than I can. The one and the advice we got from doctors was use that cases per 100,000 because it's the most effective for looking at transmission and how the community is looking. So I think for clarity of Edmontonians, for simplicity, using that factor is helpful. But because there's still so much unknown in terms of will there be a fifth wave, what will happen, we strongly feel that the 10 is not quite enough right now, and we're at 5 now, and which is why we wanted to have a meeting earlier. So, Dr. Sikora, do you want to add to that? I mean, we talked a lot about this last summer when we set the cases per 100,000, and I think you spoke well to it then.
Yeah, the case per 100,000 is more of a real-time rate, and it's probably the best of multiple not ideal options. And I guess if we put into context several things, when Councillor Knack, your opening statement indicated a reflection of the ICU overcapacity that we have right now, and a case rate of less than 100 per 100,000 is, albeit a real-time indicator, the lagging indicator, which is an indicator of hospital and health system stress, is that we're still quite stressed. So we haven't really made the turn for that healthcare recovery phase yet. So having a flexible definition of a bylaw trigger, I think, is a very reasonable thing to be able to do, because it puts into context all those multiple viewpoints, healthcare system stress being one of them as well.
Okay, well, I'm definitely out of time. I'll come back around with maybe a motion.
Thank you, Councillor. And we're going to be running short on time, so I would really encourage councillors to remain within 5 minutes, please, if you can. Councillor Jans.
Thank you. I certainly support the recommendation. Administration is floating to us about removing the triggers. I think that's eminently sensible. I think a number of us on council have young children who are not vaccinated, and every time we leave the house, and every day I do a pickup from daycare, and every morning I wonder, is today the day when we're going to get a Delta variant? And it certainly is a ever-present stressor for many parents and young Edmontonians who I think sometimes we forget are unable to get vaccinated and do require our care. So certainly a mask is a minimal sacrifice. I wanted to ask a bit about Calgary passing a mandatory vaccine bylaw, and could administration comment on, now my memory's hazy here, but I believe Calgary passed a bylaw saying that if you can, you should have a vaccine checkpoint. But then I think subsequent to that, the province did bring in new legislation that would have rendered the Calgary legislation moot. I'm just wondering if administration could comment, or Dr. Sikora could comment, do we have any gaps currently in ensuring vaccine compliance at events, shops, etc.?
I don't believe we have any gaps. The entire community has been really helpful, and many organizations instituted mandatory vaccination policies for attendance before the city did. So we've had a lot of support for this. But I think in relation to the specific question about Calgary, I'm going to ask Ms. Jacobson to answer that, because she, I think, was in conversations with Calgary at the time about that. So go ahead, please, Ms. Jacobson.
Thank you, Mr. Corbold. So what Calgary has done is they've passed a bylaw that requires any eligible entity that is eligible for the Provincial Restrictions Exemption Program to participate in it. So they didn't go over and above any of the current allowable options. They just simply mandated that if you are eligible, you must participate in it.
Would such a bylaw be necessary in Edmonton?
I don't believe it is, because so many of I can't even think of a single example where it hasn't been adopted, and we heard loudly at the time from businesses is that you could make the choice, keeping in mind that if you don't choose to be a participant in the REP program, then you have to have more physical distancing and other protocols that must be in place. You can loosen some of those protocols if you take part in REP, but you have increased protocols if you don't take part in REP. So I think that is the appropriate choice right now for businesses and organizations, and we've seen huge compliance and adoption of REP anyways, that I don't think adding that as a bylaw would significantly or even partially improve health here in the city of Edmonton.
Okay, thank you for that. I will flag that I'm very nervous about the holiday shopping season. I'm hoping that many Edmontonians shop local. The last thing we want is a online digital retailer spend Christmas where we're sending rich executives into space because they're so wealthy. I think what we want is to support our BRZs, support our main streets, support our local economy. And so anything that we can do that makes people feel safe, that they can go out, that they know that mask bylaws, vaccine checks, other pieces will be in place, I think would be be very much aligned with city plan and our vision. Finally, I mentioned this before, but door knocking this campaign, I had numerous instances where I was visiting someone who had lost a loved one to COVID, had a surgery delayed, had numerous instances of heartfelt stories. Some folks bursting into tears, sharing with me, and I wonder about the potential for Edmonton as the capital city of our province to have some sort of a commemoration or some sort of a I don't know whether it's a physical monument and sharing an acknowledgement of the loved ones lost to COVID and the sacrifices of healthcare workers, or maybe it's a, when safe to do so, some sort of a service or a memorial or something. But there's this emotional gap and this tension in the community that is palpable, and I promised if elected I would raise it in some way to find a tactful and meaningful acknowledgement of the almost 3,000 Albertans who have died, and I believe 1,500 Edmontonians almost who have died. But there needs to be some community closure and some meaningful emotional outlet here, and I'm not sure what that is, but I just want to leave that with administration as well too.
Yeah,
Thank you, Councillor Jens.
It's a great question, Councillor, and we had considered that at the first anniversary of the start of COVID, and we continue to consider that. I think there will be a time for that. My concern at this stage is that we're not over this crisis yet, and sometimes commemorations can send a signal that it's over. And so we will continue to look at that and look for opportunities to do that. But we strongly feel that right now we want to focus on fighting this pandemic. And when it is over, when there's a time where we can say that, I think it's an entirely appropriate thing to do. We'll bring recommendations for it.
Thank you, Councillor. Councillor Brinsby?
Thank you. And Councillor Jans, I like that idea. I think that's nice. And Mr. Corbold, I agree with you. We would need to wait on that, but I think that's an excellent idea. The question I have is, do we know why the roughly 5% have not had their second vaccination? Is it simply because there hasn't been enough time in between, or have they decided not to have their second vaccination?
Yeah, so for the City of Edmonton employees, that for 5%, I believe that's because it's a result of the policy we put in place, that people chose to get vaccinated because of the policy, and they've been very collaborative, and they've gotten their first shot. And we think if they've gotten their first shot, they're going to get their second shot. But of course, there's a 14-day lag. So I think what you're seeing there is the last employees who got the shot because we ordered them to get the shot, essentially, and they're complying with the policy. And so we're just, wanting to be completely aware of where they are. And I anticipate that all that 5% will soon become fully vaccinated because they've shown compliance by getting the first shot. But it takes a couple of weeks. So.
Just 28 days between dose 1, dose 2, and you're considered fully immunized or fully protected 2 weeks after your second dose.
All right, and I thank you for that information. And also, I just wanted to mention that I think when you're asking 1 million people to be complacent or be in compliance with restrictions, it's difficult when the restrictions are always changing. So we need to keep that in consideration as well.
I absolutely agree.
Thank you, Councillor Principe. Councillor Salvador.
Thank you so much, and thank you, Mr. Corbold and Dr. Sikora, for this update and presentation. And yeah, I'm happy to see that the recommendation that's going to be brought forward is that third option around the removal of triggers. I think that's a very reasonable approach, especially as we're looking to get our little ones and our kids fully vaccinated here. So my questions are around just digging into a few of the implications around the options. So the first one I have a question about is if we were to go to that 28 days instead of 10, just doing the math here, we've had a handful of days at this point, 5 days, where we have seen rates under 100 active cases. Even if we were to move to that 28 days, if the current rates were to hold, wouldn't that basically take us right up to the holiday season? And I'm under the impression that holiday season, obviously that's when a lot of mixing occurs, and I just see a lot of risk there for opening things up at a critical juncture.
That's exactly the reason that it's an option, but not one that the administration is recommending.
Great, thank you. And I guess to Dr. Sikora, is that line of reasoning fair?
I think that's fair.
Okay, thank you. And then just to the third option that's being recommended, I guess my question is, what would the process be for bringing that back? And how often could that be brought back? And I'm not saying that would happen around this table, but could it be continually brought back? And in the context of even like Robert's Rules of Order, does it have to be brought back by the prevailing side? How would that work?
Yeah, so it's very flexible is the answer. The mayor and I can call an EAC on 48 hours notice, I believe is the minimum. It may be 24, but it's a small period of time. And that's where we would want to go first, because that's where we have a great opportunity to present details and the latest data. And then, of course, we would have Dr. Sikora and others could partake in that discussion. So we can essentially do that anytime we want. And then, of course, the decision would be made at council, and we have enough council meetings that there's always one close enough, as in the case of this afternoon, that we can get that onto the agenda. And so we haven't had any problems getting decision points to council or council not being able to make a decision. The last thing I would say is if we went with option 3, if that were decided and we amended the bylaw in that case, we would go to a council reporting, probably a weekly reporting. So we would give you data on a weekly basis, and we would share that with you by memo so that you could see where the trends were going, and which gives you the opportunity to call the meeting if you want us to make a recommendation. But I think we watch this pretty closely. I think if we got to a point where things were really getting good, we would come to you with a recommendation. But so from a procedural perspective, the simple answer is you can ask us to come, or we can ask you for time to present a recommendation at any time.
Okay, thank you so much. That's very helpful. And then just a really quick point of clarification. So in the presentation, you mentioned, children 5 to 11 years old are anticipated before the end of the year. Is that available for vaccinations?
I think I'm going to defer to Dr. Sikora on that, and hopefully I didn't steer you wrong, but
No, I just wanted to make sure I fully understand that.
So we are awaiting Health Canada approval
Yep.
of the immunizations for that age group. Though that then goes to the National Advisory Committee for Immunization to provide recommendations to the provinces. Our province has to receive those recommendations. We then would implement a program to be able to provide that service to the 5 to 11 age group. In the background, we are preparing to have that service stood up before the end of the year, very much in anticipation of those approvals and recommendations and having successful delivery of product into the Alberta environment. So a lot of things have to line up, absolutely, but we're preparing in the background for that eventuality, and we expect at some point in 2021.
Great. Thank you so much.
Thank you, Councillor Salvador. Councillor Stevenson?
Thank you. I just wanted to share again that on the doorstep, I did hear so much gratitude from Edmontonians about the leadership role that the city took in addressing COVID. So just wanted to be sure that you hear that message often. And I just have two quick questions for Dr. Sikora. And I apologize, I don't know if this is the right channel for me to be raising this issue. But I know that a number of bridge housing facilities have been struggling in our community. When they're put on outbreak status, they're not able to bring in any new folks. So folks who are unhoused, what that has meant is that we've actually had quite a bit of capacity in some of our bridge housing facilities, but we haven't been able to fill those spots due to the outbreak status. And particularly in bridge housing facilities, individuals do have their own rooms. They are able to safely isolate in the facility. Just wondering if there are some adjustments that can be made to that policy to ensure that we are able to provide shelter for those that don't have housing, while still maintaining facilities for people to properly isolate.
No, and thank you very much for that feedback. A lot of the outbreak management processes are under guidance of Alberta Health. And that's the flip side of that is you are correct that a lot of these places that have sort of designated suites, it's relatively low risk. A lot of those precautions around hand hygiene, masking, environmental cleaning have been very well instituted and picked up by many of our partners across the Edmonton area. So I don't fully understand or appreciate what the challenges are, but it sounds like there are challenges. I'll certainly accept that feedback and be able to help ask some further questions around that.
Really appreciate that. Thank you. Also, just thinking about the ready for recovery idea, it occurs to me that in other countries, it is typical, it's a social norm that if you have a cold or the flu, when you're out in public, you wear a mask. I'm wondering if there's any conversation about, now that we've normalized mask wearing to a certain extent, if we carry that through even post-pandemic to keep our workplaces and our city healthier by preventing transmission of flu, which we've seen has been very successful with masking in our current restrictions. So just wondering if there's starting to be a conversation around that, around how we potentially carry through masking and potentially policies at the city as well.
yeah, I might just start with that one to say that it was really interesting when we were doing our occupational health and safety assessments of City Hall, when back in July, when we thought there wasn't going to be a fourth wave, there was certainly some speculation on that. The conclusion in terms of the protections we have in City Hall here with the plexiglass in front of you was that even if COVID is over, we should keep these in place for the flu this fall. So I think it is a great question. I think it's a great dialogue. Even when masks bylaw has been suspended for times, we have in the city of Edmonton kept it within the workplace. I think ultimately it becomes a occupational health and safety workplace decision to make, but the key is that's where, if you do the assessment properly, it will lead you down that path that you should keep masks on as a particular contingency in the workplace. And I don't think that we would recommend any bylaws to that effect, but the city of Edmonton would certainly lead by example with respect to that.
And I think just to build upon that, I think you speak to a broader social consciousness or awareness that perhaps we will see a societal change around. You don't go to work sick. If you got the sniffles, you stay home, for Pete's sakes. And certainly the social norms around masking perhaps will change. Social norms around hand hygiene, around use of alcohol-based hand sanitizers may change. So I don't know how much of that will stick, but certainly Canada has shown itself to be a very compassionate, kind nation that takes care of each other and takes care of its most vulnerable. We want to be able to do the right thing for the right reasons, and perhaps that's something that will stick more long term.
And that was also a consideration when we looked at our flexible work arrangements for office workers in the city of Edmonton, because when you adopt that that process, you have less people in the workplace in cubicles, and you get more social distancing. So it's again just reinforces that it's the combination of all those safety protocols that help, not just any one.
That's great. Great to hear that those conversations are happening, and thanks for the answers.
Thank you, Councillor Stevenson. Councillor Rutherford?
I have so many questions. I'm trying to figure out where to start. You mentioned lagging indicators, such as the fact that the hospital is still stressed, Dr. Sikora, is that correct? I'm wondering, if you could talk a little bit about some of, what I'm worried about is, if there is a fourth wave, when we think about some of the residual effects of COVID-19, so not the direct deaths related to COVID-19, but, cancellations in hospital systems, cancer treatments that are postponed, all of those kind of things that are causing long-term impacts. What kind of lagging indicators are we going to want to look for there and some of those residual effects of the stress that this current healthcare system is under?
That's a great question, Councillor Rutherford. So as we contemplate exiting the fourth wave and going into the fifth wave, there are going to be a lot of things that we are left with. Some of those are those delayed procedures, delayed surgeries themselves, and that is something that I know Alberta Health and Alberta Health Services is actively monitoring as we exit the fourth wave. Anyhow, so that is something that is being watched very closely. In terms of long COVID, we have stood up individual clinics, both at the University of Alberta Hospital, but also clinics in partnership with our primary care network partners to be able to help take care of people who have recovered but not fully recovered from COVID itself. We're actively supporting our family physician teams across the Edmonton and Northern Alberta environments with a specialty access process, so protocols, but also access channels to be able to support them in supporting their families, their patients in their medical home, so in that exact home itself. But I think some of the things that will have to be watched very carefully over time are what are the social impacts of COVID. We see an expansion of and stark increases in opiate overdoses and deaths related to drug poisoning over the past 2 years. We see a great deal of mental health challenges. We see economic challenges. So a lot of these indicators are going to be both in the health sector, but also in the social sector, in the mental health sector as well. So I don't have a complete answer in terms of what is that full package that should or could be monitored, but I think that's going to be there's going to be a lot of work over time to help develop what those could and should be.
That's great. And the reason I ask that question is because, please correct me or if I'm wrong, but my understanding would be that, the masks are one of the easiest ways to be as a preventative perspective for preventing the spread, a way to mitigate some of these, not just impacts of COVID, but some of those residual effects of continuous waves. Is that correct?
Masks are one tool in the community toolkit. The hand hygiene, the masks, the physical distancing, the getting immunized, staying home when you're sick, our remote work, getting tested in isolation are other tools in that toolkit, along with environmental cleaning. So it's one tool in the toolbox. It's an easy tool. but it does require a decision to be made by an individual to be able to protect themselves, but also those around them.
Great, thank you so much. And then, can you confirm, is the number of cases in children under 12 currently going up? Or I heard somewhere, and I feel like it was CBC Radio as I was driving one day, but I don't know if I'm correct in this, so I want to just get the correct data from the source. Is that number going up, or is it the percentage in relation to adults that are vaccinated? Is there something going on there with the under 12s that, in terms of case counts?
Oh my goodness, I'm just rapidly trying to look at the Alberta Health interactive data portal for COVID-19. Perhaps that's something we can get back to you on.
Great, thank you so much. And again, I ask because, while it is hopeful, and as a mom of 2 kids under 12, that happens before the end of 2021 that they can. Currently, they are still not able to. So that is a factor for decision-making for sure. Thank you.
I'm sorry, I just can't bring that data up here quickly. We do know that there have been transmission events within school environments, and being a parent of two young ones myself, we are very worried about that environment. We do hope to have an immunization program in place for the 5 to 11 at some point this year. Again, preparations are being made for that, and that will certainly be helpful. But to be able to be considered fully immunized does take 2 doses, typically, spaced 4 weeks apart, and then you're considered fully immunized 2 weeks after. And I know there's a lot of parents that are looking forward to this, our household included, but it is part of a process.
Thank you.
Yeah, thank you. So we'll please provide that information through our administration, Dr. Skora, on the infection among kids. Councillor Dang.
Thank you so much for the presentation, and I will echo Councillor Stevenson's comment around, thank you for, certainly, we've seen cities around the world actually stepping up in their leadership to manage and overcome this crisis. I want to come back to the options, just so I can hear a bit more. I think, Mr. Corbould, you mentioned that the third option of lifting any kind of trigger is consistent with other jurisdictions. Can you just speak more to that? Just, what are some of their learnings and other examples, and what is currently happening in some of those other cities?
Yeah, I mean, it is a bit all over the map. Different cities have made different reasons. I mean, our reasoning for triggers was very much tied to continuity of government and going through a transition. That was the overwhelming piece that led us down the restrictions road. And as we compare with other municipalities, we find if we make a decision, somebody else reconsiders their decision. And to be honest, I think when Calgary made the decision to go to 28, that got us immediately thinking about, should we go to 28 or should we do something else? So, but that policy that we're recommending is consistent with a lot of cities. I don't have the list in front of me.
Okay.
We could probably get that. But I think it's fair to say, we collaborate a lot with the city of Calgary here in Alberta as the 2 big cities here. We work with other big cities across the country. And anytime we are considering a decision for council, we do a jurisdictional scan of what other big cities across the country are doing. And we're able to answer questions on that. So we could probably have more for you on that at a council meeting when we consider the decision. But I'll just see if Ms. Jacobson or Ms. Parry want to weigh in on that, because they're the ones who are usually having those conversations.
Hi, hello everyone. Yes, I would agree with Andre that we do check in and we do those jurisdictional scans. But as we make changes or as others make changes, that can impact overall where we're going. So we are mostly in contact with the City of Calgary, and we will check in with them again today to see if they're proposing any additional shifts or changes.
I will just say quickly that my experience is that we're often on the leading edge of a decision, as we were with the mandatory vaccination policy, as we were with some of the mask policies. So sometimes we're leading, which isn't a bad thing, but it's hard to see what others are doing when you're leading.
That's great. Thank you. I'm always interested for these jurisdictional scans, recognizing it's a very fluid situation, and every jurisdiction has a lot of different context. Maybe this is a small question, and maybe I missed it somewhere, but for that case count, 100 per 100,000, why not 50? Why not lower? I mean, I imagine there's quite a bit of research and evidence around the world that kind of led to that point, but yeah.
That number of 100 per 100 cases was at a time when we were at about 230 cases. It was based on speaking with Dr. Sikora, speaking with some other doctors at University of Alberta, and the question that council asked at the time and got quite a lot of answers on was, the reasonableness of that as a point. So we discussed 50, we discussed higher numbers, we settled on 100 based on what was reasonable based on all the health advice we were getting. But it is a subjective number.
Okay. Oh, go ahead, Dr. Sikora. Did you want to say something?
Yeah, it was a reasonable compromise, and it was crafted in an environment where we had not as high immunization as we did now. But it was also 100 per 100,000, Andre, I think was also one of the triggers that Alberta Health had utilized for broader community action or community discussion. So it was something that it's a nice number. And it did seem to at least provide an indication of what community transmission and perhaps that community risk may be.
Yeah, and just to your first question, Councillor Tang, I've just got confirmation that both Toronto and Mississauga have recently extended their mask bylaw in line with recommendation 3. So there are 2 specific examples of municipalities that recently made a decision that we are recommending.
That's great. Thank you so much.
Yep.
Thank you, Councillor Tang. Councillor Cartmel?
Thank you. Again, thank you for the presentation and the discussion. I have one question first of all, and that's around our rec centers. I believe that the provincial advice was that access to rec centers for kids over 12 would not require a vaccination record, whereas the city's rec centers do require a vaccination record. And I had a bit of feedback, primarily at the sort of those fringe communities that are as close to the counties as they are to the city facilities.
Yeah, I would not characterize it as provincial advice much as I would say that the province decided not to impose that in any of their considerations. When I had heard that, when that came up at the time, I phoned Dr. Hinshaw myself and I asked, is it reasonable what we're doing in terms of keeping that requirement for kids above the age of 12? And the answer I got was, yeah, it's reasonable. And then we spoke with a lot of organizations like Hockey Canada. We spoke with the 2 school boards who use our rec facilities for activities. And we came to an agreement that it was reasonable. But we also came to an agreement that we would allow supervisors of those groups, say a teacher or the coach of a hockey team, to declare on behalf of all the people so that every individual, child above 12 did not. So we made it easier for rec teams in particular to do that. But yeah, we did check in with health on that from a policy perspective and from an operational perspective, and it was deemed reasonable. I will say we were an outlier in the region. Most of the region municipalities did not go that far. We've had some comment on it, but I still think it was the right thing to do because, again, it's part of that culture, and people are, once they show once, they start showing and make it easier to show again. And it's particularly getting easier and easier now. You can put it in your Apple Wallet now easily, and so we think it's the right thing.
Yeah. I mean, certainly it's easier and easier now, and we're conditioning some behavior. So that makes sense. I just wanted to publicly ask why we started down that road.
Yeah, and I think it's also important to keep in mind that health has to think about the entire province. So quite often when they're making recommendations, it's a minimum recommendation. And they're considering rural and all sorts of different circumstances. But I specifically asked the question: Are we out of line, or is this unreasonable? And I was told no, it's not. So,
very good. On the question of triggers, there's a bit of a yin and a yang conversation here. One is that the triggers might. quite frankly put us in the situation where we are today, where we put a trigger out there and then we're not quite sure it's the right one, it's somewhat arbitrary, those kinds of things. So maybe we don't want to have an automatic deactivation of the bylaw. What about a set of triggers that would trigger a council conversation? You know, and maybe it's a collection of parameters or a couple of these parameters. I understand what you said earlier, Mr. Corbold. You're going to be informing us, and we're going to be talking about this pretty much consistently and constantly anyway. But as something that we can broadcast to our constituents to say that this is going to remain in place for now, but there is this set of metrics out there that you can look to for sort of an end goal or a light on the horizon, so to speak, a motivating element.
Yeah, I would just say that almost every time we've tried to set something, we've come back to you later because something else has happened. And so
Yeah.
I worry about triggers. And I think, you know, we can send a clear signal that we will absolutely closely pay attention to the cases per 100,000 case, just because we're not going to set if we decide not to set a trigger, that does not mean we won't be watching that every day and, you know, working with you. But so I'd just say that approach gives us the greatest amount of flexibility. And again, the triggers for me were about continuity of government during a transition period, which is less of a concern. So
I understand. Sorry, I don't want to come for a second round. I understand that, but I'm also reminded of a committee meeting where we had well over 100 speakers because there was no goal in sight. It was never going to end, you know, air quotes, it's never going to end. And to provide something that says it's not necessarily going to put an end or deactivate the bylaw, but it is going to compel council to talk about deactivating the bylaw if we hit these three things or these four things.
yeah, and certainly if that's the will of council, we could come back with something like that.
Yeah.
And if we did, I would say that base it on case counts per 100,000 because that's the most timely one.
Maybe that and kids vaccinations and emergency room, like the things we've talked about here.
Yeah, it certainly wouldn't be a problem for us if you wanted to go down that road.
Great, thank you.
Will you be able to do that if we were to think of considering the bylaw today or tomorrow? Would that require some more time?
No, I think we could do that pretty quickly. We've got people writing right now, Your Worship, and we're pretty nimble on this, so I think we could bring forward that as a consideration if that was something council wanted to
Okay,
consider.
thanks. Councillor Rice?
Thank you, Mr. Mayor. Thank you very much for the good information. From that information, I think we can clearly see the strategic alignment city put on and to implement how to respond to the COVID-19 this pandemic, and also how we implement the public health orders. I do believe a public health order is so important, and then because that is number one care for us to look after our people and then in the risk and also in the public health. From the data and then provided here, I did see very positive results come out, and based on this strategic alignment implementation. And so our active cases right now compared to September 6th, and then it's only like 1,421. That's even though, and then total case to date, that is over 100,000. So that is very good indicators. And also I look at the city of Edmonton, and for the fully vaccinated, and it's 85.3%. That is higher than 81.2%. I think I would like to take this opportunity and to thank everybody's hard work. And also I would like to take this opportunity to thank our public collaboration to share our social responsibilities and to protect our people. And I think that is very good. And based on this data and tells us. And also I would like to bring some different voice I heard at the door. in terms of our what is our city for, I really appreciate Councillor Jens and present that idea and to reflect our city care about everybody, and also and from diversity and inclusive perspective, I heard two different voices. I would like to bring this voice to the council and also to the administration, and also I think public is already aware of these two different voices. So the first one is what I heard on my campaign trail is about, we got the question, city council, specific city council was questioned by the public for some voices. So some voices about if we have provincial health authority from both of policy and operational perspective, and then look at the city council, we don't have any expertise on medical. And so why do we need a vote for certain things? So I'm not seeking for the answer. I just want to bring the voice and to reflect everybody's voice to be heard at City Hall. So why we need to vote certain things, and then for the medical expertise of professionals, they need to do, they have specifically, and Alberta, government of Alberta have that health authority and the health department, and the AHS as an operational body as well. So that's his first voice I would bring to our city council for our attention. So the second voice is about medical, a personal medical choice. Like I mentioned earlier, I believe our society and then most people and then understand that public collaboration to share our social responsibility to support our public health. And then my question about this one is, do we have any process in place as a decision-making body and or as a service provider, operational body to address those voices? So yes, we heard different voices from the public. So we addressed some voices very effective and very good, but for some voices, and then from public perspective, how we remain that inclusive and diversity. And so that value or that principle can apply different areas. So from that perspective, I think the voice I brought to the City Council today, and I just want increase this awareness. And yes, for any decision we made, and we will receive different voices. But do we have some process in place, or do we need to create some process to address this different type of voices?
Point of order, Mr. Mayor. Time is now at 27 seconds after the question that was asked after the 5 minutes.
Okay, well, yeah, it's, I'm just trying to be as flexible, Councillor Burkett, because we just all knew as we get into the process, but point taken. Thank you so much for that.
Oh, absolutely. No, I remember you wanted us to stay within 5 minutes.
Yes, absolutely. Thank you for that. Go ahead.
I would say that I think we have lots of processes for that, including discussions and deliberations in this council. And we heard, as was alluded to before, a lot from different voices. I would also say that, you know, we have done a lot of seeking perspectives on recreational facilities. We've sought perspective on transit. I think that, you know, that was a really good example, I think, because before we reviewed the mask bylaw, the mask face covering bylaw before, we went out and did a transit survey for 2 weeks and heard loudly that 84%, I think, was the number of transit riders we felt more comfortable with face masks. And we hear that often about recreation facilities, that people are really comfortable with our policy. So I do believe we have lots of opportunity, including the proceedings that happen in this chamber. Then secondly, I would just say on the authority, it's true, and we've been very clear that there is one health authority in the province, but it's also true that this body of council has the ability to make positive decisions to help combat this virus. They've chosen to do that, and we make sure we get medical advice to them to consider those decisions. And I would also say that in my discussions with the province health department and with Dr. Hinshaw, there's not been one decision that this council has made that hasn't been positive and supported by health authorities in terms of they may exceed the provincial health authority, but they've all been supported by the provincial health authority because they are taking sort of a minimum standard approach across the entire province. So they've never said to us that that was a bad decision or from a medical perspective. They've always supported our decisions.
Thank you. Councillor Wright?
Thank you. I just wanted to, just a clarification on one of the slides here in the presentation where it indicates City of Edmonton active case rates. Just because we are a larger metropolitan community, is that specifically City of Edmonton, or is that Edmonton Zone, AHS's Edmonton Zone?
That, I believe, is the City of Edmonton. If you're looking at current status public vaccination?
No, sorry, it's the slide on future decisions, City of Edmonton active case rate tracker.
So if I may, Andre,
Yeah,
that is
please.
a regional number. That's the Edmonton zone.
Okay, thank you very much. Just wanted to clarify that.
Thank you, Councillor Wright. Can you take the chair, Councillor Wright?
Yes, I can.
Yeah, just a couple of questions. Just want to follow up on Councillor Jan's observation. I think that's very important that we figure out a way to commemorate and acknowledge the pain and the trauma and anxiety that COVID pandemic has caused to so many Edmontonians, and how do we put closure to that? So something to flag once we are out of the COVID situation. On the provincial restrictions, do we have any indication on the masking bylaw and or the restrictions? Any indication what their plans are, if they're thinking of lifting those restrictions?
Nothing imminent, Your Worship, but we do have good collaborations and meetings with them, and usually we get a notice before they do something imminent, but we have nothing imminent on right now.
Good. And what is the situation in the regional municipalities? If on the masking bylaw, I just can't remember if our surrounding municipalities have similar to ours masking bylaw, or
I'm going to defer to Ms. Poirier or Ms. Jacobson on that to get the status, because I just don't have it in my head right now.
Yeah, our understanding is that our regional municipalities are following the provincial health order. So when their mask bylaw is rescinded, that's what our regional municipalities will do as well.
okay, so regional municipalities don't have their own masking bylaw in place.
Some of them did, but when they all sort of either just before or just after the election decided to just stick with the provinces.
Oh, I see. Okay.
When the province
because the
imposed-
provincial masking bylaw came right after, a few days after the city passed its bylaw.
Exactly, and then that's when a lot of municipalities said, okay, we're just going to follow the province.
So if we make the changes, that might actually encourage regional municipalities to look at similar changes if provincial mask bylaw is lifted. May or may not.
Yeah, and I would say I don't have as good a perspective on the new councils in the region yet, Your Worship, so I think we'd be hesitant to declare that.
Okay, good. But something we can lead by example, and they can always look up to that if they wish to do so. Good, thank you. I'll take the chair back, Councillor Wright.
If I could, Your Worship, I did have a bit more information on one of Councillor Rice's questions that might be helpful for Council.
Yeah.
I just wanted to note that we have an initiative. It's called the Edmonton COVID-19 Rapid Response Collaborative, and it's an initiative of 13 social service agencies, and they are established to provide required supports to COVID-19 affected individuals and their families. And these agencies include organizations with Indigenous populations, newcomers and refugees, ethno-cultural groups, people with disabilities, and other vulnerable population groups in Edmonton. So I think it just speaks directly to Councillor Rice's question about the voices. So
Okay, good. Thank you. We have 15 minutes and we have 4 members on the list to speak or ask questions. So if we could manage that within 15 minutes, I would really appreciate it, and give some direction to administration. We can't give a direction without some general senses from here for you to follow up. Councillor Knack?
Thank you, Mr. Mayor. Yes, I appreciate that. So I just want to, so with that in mind, I'm trying to remember, in terms of the rules, we can't recommend to council from this committee, but we can provide direction around what we might want to have talked about at an upcoming council meeting. I'm just trying to confirm what we're allowed to.
So you can request that the Emergency Advisory Agency review an issue. So you could have a recommendation for a report from them to come to council.
Okay. So the reason I ask is that based off some of the questions, done some draft wording on a motion that would at least provide it. So I'm going to echo what Councillor Cartmel had said around. I do think there's an importance of having triggers that would generate a conversation and not the repeal of the bylaw, just to be clear. So I did send some wording over, and I'm just wondering if we're able to edit it on the fly, or I can come back after the other few have asked questions if we can.
Yeah, that's a good idea. Let's get to
finish
other
those questions
questions.
and I'll come right back because we've just got to fine tune the wording a little bit.
Okay, good. Thank you, Councillor Knack. Councillor Rutherford?
Okay, so I just wanted to follow up actually from the inquiry from Councillor Tang, because I did look up Toronto and Mississauga's bylaws after they were mentioned, and I want to be clear that Mississauga has, as of October 29th, amended their bylaw to a new date of March 2022, and Toronto has extended their bylaw till the end of January 2022. So they have not put a cap on, they have not removed completely any time triggers for their bylaws. So I just want to correct that for the record. I also agree with some of my colleagues that there needs to be some, I would recommend a time, whether it's March 2022, that it regardless would come back before council for update and sort of, a review, like some bylaws do on a timely basis. This one would just have a quarterly review or those kind of things. I think, seeing that sort of that community-based trigger, while well-intended, doesn't totally take into factor all of the context as we're seeing here. Now we're talking about it again, right? When the numbers in the hospitals and the stress of the system are still high. So I would rather see something like March 2022, where it, until then it's in place, but similar to number 3, it could be brought back earlier if directed by administration or council. But at minimum, March again is just the number that's coming to my head. Because when I do I haven't done an intense jurisdictional scan, but I would be hesitant to be able to find a single municipality that would have done no sort of trigger of some sort of timing for that bylaw to come back. And second to that, I don't want to put a trigger that creates false hope, because we've been doing that too. We've been putting in, once we get to this goalpost, we'll remove it. And then we get to that goalpost and then we are here where we are. And so I think creating false hope for people is just as bad as creating no hope. And so I think that we need to have a middle ground there. And I think if there are jurisdictions that do have no time cap, I would love to see them, but those 2 examples are not those. Thank you.
Thank you, Councillor Rutherford. Councillor Rice?
I do want to follow up my first round questions, and specifically, I do believe it's my responsibilities to bring my ward's voice to City Council administration, and I think it's important and for us to listen to everybody's voice. Is not only listen to certain type of voice. We just pick. We want to listen. So I want to emphasize that. And then thank you very much. And to clarify, there is more process and initiatives. And I would like to request the detailed information for that. That will help me and to support communication and with the voice I heard from my ward.
Understood.
So also I do want to emphasize, and I think public health is our number one care. I believe everybody understands this and care about that. And then even for myself, I'm fully vaccinated, and then I want to support the public health. And then also I do believe from government perspective, we do need that strategic alignment to implement some public health restriction orders. That is no doubt at all. Just from the voice perspective, we need to put that thought forward and to listen to every voice. And even though the voice is not like we want to hear.
Thank you, Councillor Rice. I know I'm going to go to Councillor Neck. But what would be the simple, like we don't want to complicate it too much that public gets confused. Okay, what is the trigger for review? What would be the simple suggestion or trigger that you would suggest? Whether, I know Andrew Neck has a motion that he's developing. It has 4 points to it. Maybe we can put it on the screen to see it if that is possible, Madam Clerk, right? Or we just, a date might be a better trigger than all those triggers. Like we want to make it as simple as possible that we're not confusing people.
Yeah, and let me just say first, sorry, I made a mistake in terms of Mississauga and Toronto. They removed the triggers. They didn't remove an end date. So I was talking about the triggers that they removed, which they have removed. I also understand that I think the easiest trigger is, in my opinion, Your Worship, is to tell us to come back at a routine date so you can just consider everything. And we were comfortable with doing that from a memo perspective and then calling a meeting if we have to. But I think another jurisdiction has, asked for sort of monthly updates. And I think the difficulty is when you set an end date, and I can recall when the end date of December 31st was set by this council, it was that'll never happen. We'll never be out that far, and here we are talking about it. So I worry about the false hope as well that they could provide. I think Edmontonians understand we have to be agile, so the easiest thing, the clearest, simplest thing is to ask us to come back on a routine basis, which we're prepared to do, or by memo. If you want to attach that coming back specifically to criteria, it does not cause any problem for administration to do that effectively, and that does add a bit of certainty as people see the case numbers if they're following them. And if we were going to do it, I would say cases per 100,000, perhaps because it's such a topical point, the vaccination of children under 12, because that is getting a lot of attention these days, would be my recommendation.
So, Councillor Knack and Councillor Cartmill, would it be, I'm just keeping in mind the agenda that we have today and over the next week, like if when they come back today or tomorrow for the bylaw amendments, that we get a report back, say, December 15th. And during that time, it also gives them the time. 15th will be an update, not to repeal, but an update on how things are going and the COVID situation, and how long this bylaw needs to be in place and all that. So I'm just thinking about, because those 4 points will trigger a debate, absolutely, right? Just to think about. Yes, Coster.
From that perspective, to have the conversation around the motion that Andrew and I have crafted, that's fine, but we need to do something in the next 5 days, or the bylaw
Yes,
is repealed.
absolutely. That's why I was saying.
Right.
We need to give them direction to continue the bylaw.
And if we just go with a simple recommendation, which is aligned with 3 now, it does not prevent council from adjusting and adding more triggers on 15th of December. You can do that anytime you want. So that gets us out of the imminent potential trigger being enacted. And then we can come back on the 15th with clarity triggers or whatever you might like. So.
Councillor Knack?
Yeah, and I'm fine with that. So the wording is there, and essentially I wanted to make sure there was still some wording so that we could draft what those amendments would look like. Whether or not council ends up using them, it's fine. That's a separate debate, not for today to resolve. But I would like to, at some point, doesn't need to be today or tomorrow then, still provide direction to draft something like that. And have a timing piece, because I like the idea of both, having triggers and still a regular check-in at council. I'm not ready for memos yet. So with that in mind, I don't need to move that motion right at this moment. I can probably do that subsequent to the this afternoon. Do we need to give direction though for something to come, or do you already just have it planned to come on this afternoon? You need to have some type of direction that we're going to option 3.
Well, right now, provided council agrees to the adding it, which we'll have to do when we resume, our intention is to come back with a recommendation this afternoon.
Okay, then I won't move that, Mr. Mayor. I will move that subsequent to our
motion?
conversation
That makes sense.
to have draft amendments created.
Got it.
Okay, thank you.
So the sense I get here is that we want actually the mask bylaw to continue, and the census on third option. So if you could come back to us either today or tomorrow.
We will be prepared to do that.
When would, today or tomorrow?
We're ready today.
Okay, so we resume our yesterday's council meeting at 1:30, which is in private. We can conclude some of their work, then come out in public and
my request would simply be we put it at the latter part of that meeting this afternoon, just to give some writers some time.
Good, okay, cool. All right.
We still have to move to receive this report for information, and then.
Yeah, so Councillor Knack, you're moving that we receive this for information?
Yeah, I'll move that.
And I can
Second.
Councillor Rutherford, please vote. Sorry. I'll get used to that. Sorry, please vote. I'm affirm.
I'm a yes, Madam Clerk.
The vote's not coming up on my e-scribe.
I know, for
so,
some reason. Just
I'm
affirm,
affirmative.
Councillor Rutherford, yeah.
We have all the votes, thank you.
Please display the votes.
Yeah, he voted, yeah.
Is it carried? For some reason, it's not showing on the screen.
It is.
Is it carried?
Thank you.
Good, thank you so much. And no private reports, and we adjourn this meeting. Cool. See you at 1:30.